Thank you so much, Dr. Pate, Chancellor. Thank you so much for the warm welcome. It really is an honor to be here with you today to talk about the issue of preventing obesity and preventing childhood obesity in particular, which is a strong focus area of the American Heart Association. And Dr. Pate, you set me up perfectly because one of the things I'd like to begin by focusing on is why does this matter to us at the American Heart Association? So thank you for reading some of my quotes on the internet. It's always nice when it's a good quote someone reads from you on the internet. But here's why it matters to us at the American Heart Association. It's exactly as Dr. Pate said. When we think about heart disease, cardiovascular diseases, and stroke in America, 80% of these diseases are preventable. And so one might ask, if they're preventable, why do they continue to be the #1 cause of death in Americans? And that is because we have to find a way to take the conversation back to preventing these risk factors and these diseases before they begin. Because we're so committed to this, the American Heart Association has put its entire focus on this goal, which, although it seems very simple, is certainly a challenge. And that is that during this decade of 2010 to 2020, we will focus every resource we have on improving the cardiovascular health of all Americans by 20%, while reducing deaths from heart disease and stroke by 20% during this same time period. Again, this may sound simple, but when we consider the fact that as we sit here today, fewer than 1% of Americans are in ideal cardiovascular health, you can see that we have a big job ahead of us. Foundational to the creation of this goal was a paper that we published in Circulation back in 2010 that defined what it means to be in ideal cardiovascular health. And it is the bundling of these 7 health factors and health behaviors that, when put together, define a person's cardiovascular health status. So things that sound so easy, like being active, eating better, having your body mass index at an appropriate level, not smoking, controlling your cholesterol, your blood pressure, and your blood sugar. Those are what we call Life's Simple 7. Again, the 7 health factors and health behaviors that define ideal cardiovascular health. And appropriate for today's discussion, when I'm thinking about kids and childhood obesity, is this very startling, I would say, but a reason to be optimistic slide. This shows, for men and women, the opportunity for individuals to age without cardiovascular disease and stroke affecting their lifestyle. This shows that a person who reaches the age of 50 with all 7 of the health factors and health behaviors in ideal. If you're a man, you have less than 6% of a chance, or a woman 8%, into your 90s of suffering a cardiovascular event if you can reach the age of 50 with those 7 health factors and health behaviors at ideal. But the truth of the matter is, as I said earlier, fewer than 1% of all Americans have ideal cardiovascular health. And so this focus on helping people young in their life protect the ideal health that most of them are born with is a calling and a focus for us at the American Heart Association. Look at on this slide here, if you're a man and you reach the age of 50 with 2 or more major risk factors, you have a 69% chance of having a cardiovascular event in your lifetime. This should be a wake-up call for Americans, something that we hope can get people very focused on those 7 health factors and health behaviors. This is just another way to look at that same data. The red is bad, the green is good. And so when we look at adults and the health status of adults across the Life Simple 7 metrics, you can see things like diet and physical activity, not good. We have so much work to do to inspire people to care about their health. And again, the beauty of the ideal cardiovascular health metric, it's the bundling of the 7 together that really help determine a person's health status. So why is this a problem? I found this chart and I thought it was really fascinating because here in this country, we worry so much about calorie consumption, over-calorie consumption, and in some parts of the world, there's not enough food for people to eat. If you look at this chart that shows the daily per capita supply of calories and look at the United States of America, you see that the average American consumes over 3,500 calories a day. How can we inspire people again, to balance the healthy eating with physical activity. And so an important foundational document that we've looked a lot at the American Heart Association is this Institute of Medicine report called Shorter Lives, Poorer Health. And it ranks high-income countries by life expectancy at birth. And because of the health status of people in this country, you'll see that males, the United States ranks 17th, and for females, we rank 16th of high-income countries. We have to look at this as a rallying cry for this focus on prevention and helping people be inspired to care about their health earlier in life. That same report, and many of the data, I think the Chancellor referenced this as well, talk about the fact that 1 in 3 kids are overweight or obese. And in the past 13 years, we have seen an increase of over 30% in the overweight and obesity of our young children today. And again, for us at the American Heart Association, this is especially startling when we think about the fact, again, that most children in this country are born in ideal cardiovascular health. And it's their environment and choices often that are made for them that help make statistics like this come to life. In that same Shorter Lives, Poorer Health, you can see the United States also, among children aged 15 to 17, ranks the highest of any of these developed countries based on a percentage of kids in that country. So here we are at 36% of our children being overweight or obese. We must do something about this. The average body mass index of kids in this country also ranks us dead last of these same developed countries. And so we have a problem that we need to fix. Earlier, for adults, I showed you the Life Simple 7 metrics and the red and the green, and here it is for children. And you can see the startling numbers as it relates to children, especially in the healthy diet score, and also in physical activity, when you think that 56% of children are not getting the recommended level, 8 are not getting any physical activity. This is a rallying cry, and it is the foundation of what we have focused our efforts at the American Heart Association around. In the South, of course, we are especially concerned about health disparities. I spoke earlier about the American Heart Association's goal to improve the cardiovascular health of all Americans by 20% by the year 2020, and we are especially concerned about communities where our services are needed most. When you look at this chart, you can see the disparities pop right out. You can see that Hispanic children, for example, are not getting the appropriate levels of physical activity compared to their Caucasian counterparts. The same with issues around weight. You'll see that none of our children are having a healthy diet the way that they need to. So this really speaks to the importance of the opportunity that all of you have to help change these numbers in America today. So I knew Dr. Pate would be happy if we talked about physical activity. This is, of course, a main area of his interest in his research and, of course, his important work with us at the American Heart Association as well. So why aren't kids active today? I think we hear a lot of anecdotes about the use of technology and that kids certainly don't have the same opportunities. And what we've done at the AHA is we've tried to learn and understand these statistics so that we could build our strategy to try to change the environment to help kids have a better chance of being active. You know, only 30% of children in this country attend gym class every day. That's not because kids don't want to attend gym class. That's because the environment around them doesn't allow them to attend gym class. 40% having access to a safe community playground, that is unacceptable. More than 60% not participating in any organized physical activity. And then, of course, over on the right-hand side of this slide, we will see the use of technology and how that's impacted the physical activity levels of our kids. And as a matter of fact, when we think about media consumption of children today, you can see this startling change in 10 years of kids, not necessarily their change in TV habits, but video games, computers, etc. And I think we know as adults, most of us keep our cell phone within 5 inches of us about 24 hours a day. Well, kids do the same thing. And so my thought is, how do we use these technologies to help inspire kids to be healthy? Because this is the way it is. Our children today are going to have access to these tools, so let's think of some strategies and solutions to use those to help inspire kids to be active. Our work at the American Heart Association is very simple. We strive to build a culture of health in every community in America. A culture of health is so important because it brings together the individual responsibility of people and families to focus on and care about their own health, but it brings around it the important role of communities, religious organizations, universities, as well as policies at the state and federal level. And when we can get all of those operating on full cylinder, we can create a culture of health where the healthy choice is the default choice, where people don't have to battle to try to have access to things that will bring them positive and good health. And so the culture of health strategy will, you'll see very clearly in a moment, is foundational to our work at the AHA. In speaking of kids, I talked about our Life Simple 7. We just last week launched our new technology-based tool of Life Simple 7 for kids so that children can better understand their status around physical activity, diet, exercise, etc. And we have a fun game-based technology solution for kids to know and understand their Life Simple 7 status. And we partner that actually with a plan that we've created at the American Heart Association that focuses really on 3 important strategies to help kids have a healthier life. Our first plan is to improve diet quality. We know that, again, kids live in an environment where oftentimes, because of the communities they live in, financing decisions that are made by governments or schools in those communities, access to fresh, healthy foods is not an option. We also know that in some cases, food and beverage companies maybe target children inappropriately for high sugared, high sodium, high fat foods. And so pricing incentives are very much a part of our strategy for making sure that we can help improve diet quality in America. Our second goal is to make sure that we increase the level of physical activity. Now, this child was told to go outside and play. I doubt that this is what his mother had in mind when she sent him out to play. But unfortunately, we can laugh, but this is truly what's happening in many, many families in America. And why is it? Many places, parents aren't able to send their children outside to play because maybe they don't live in safe communities. As I said earlier, many of our schools do not offer regular physical activity for our kids. Some of us grew up knowing and believing how important physical activity was to being a kid and to growing up to be a healthy adult. But when you're not exposed to physical activity in your home life and you're not exposed to it in your school, it doesn't become a natural habit. It doesn't become part of who you are. The third piece of our kids plan, although not part of our agenda here today, but certainly important as it relates to children, is eliminating the use of tobacco in kids. We have a goal that 0% of children will become smokers. Many of the organizations that have focused for decades on tobacco control are thrilled to see the number of kids smoking having been reduced so substantially, and our goal is to make that number 0. We know, for example, that children who smoke become adult smokers. And if you flip that around, 80% of adult smokers had their first cigarette before they were 18 years old. So staying focused on this is a big part of what we are doing at the American Heart Association when we think about kids. But since we're here today to talk about obesity, let me tell you about our work in childhood obesity, which is very much rooted in this Institute of Medicine report on obesity prevention efforts. And our goals that are wrapped into various campaigns and programs that we initiate are all aimed at achieving these goals: improving the physical activity environment, improving the food and beverage environment, improving the messaging environment, improving healthcare and work sites, and improving school and childcare environments. So how are we doing that at the AHA? The first way we're doing that is through our landmark relationship with the Robert Wood Johnson Foundation in a new initiative we call Voices for Healthy Kids. Voices for Healthy Kids is such an important initiative because it brings together all of the organizations across this country who care about preventing childhood obesity through advocacy. Much to the brilliance of the Robert Wood Johnson Foundation and their assessment of the fact that they were funding many, many wonderful programs in communities throughout America, but that those programs were not necessarily connected so that there wasn't leverage of organizations in working together to truly achieve remarkable results. The Robert Wood Johnson Foundation and the American Heart Association came together about 2 years ago, and we created Voices for Healthy Kids as our way to make sure that we have a coordinated and impactful advocacy approach to childhood obesity across America. The name Voices for Healthy Kids was carefully selected. Imagine how important voices are when we think about advocacy and changing policies and improving our environments. Imagine how important your voices are when you think about the impact that you have across the SEC universities to make changes in the prevention of obesity in America. So how are we doing this through Voices for Healthy Kids? We've organized our work into 6 hubs, we call them. And underneath each of these hubs are a number of organizations that are working very specifically on these strategies to help, again, improve the environment for our kids and for our families and for our communities. The first of these hubs is making sure that we have access to healthy food across America. So many communities, so many cities, there are not places where families and children have access to healthy foods. It is sad and remarkable that in some major cities in America, like Detroit, Michigan, very close to my hometown, just 2 years ago, a grocery store, Whole Foods, came into Detroit, Michigan, and before that, for 10 years, there was not a grocery store in the city of Detroit. It's shocking. And again, you wonder why children and their families are having to make the food choices that they make. And so with the help of the Food Trust, who is the organization that we have selected to lead all of the advocacy around access to healthy foods in America, we're creating real momentum. We are inspiring people through advocacy to understand the importance to the economic development in communities by focusing on access to healthy foods. We have engaged the Safe Routes to School National Partnership to lead our hub organization around active places. Now, the active places, of course, includes making sure that children and their families can be confident that kids can get physical activity by walking to school. But it also thinks about things like using school facilities for children and their families to have safe places to get physical activity outside of the school day. We're doing some remarkable work in this area, and again, I would appeal to all of you to think about how your campuses can be used for your communities to allow access to safe places for physical activity. We know that when kids are out of school, that they also need places where they can have access to healthful behaviors. The YMCA of America is the hub organization that's helping us think about our strategies and bringing all of the organizations together that are thinking about out-of-school time physical activity for children. The Berkeley Media Study Group is working with us on marketing to children. It is appalling when you dig in and look at the statistics about marketing to children of unhealthy foods and beverages. We have to have this stop. And through our work and the work of the Berkeley Media Study Group, we're making real inroads in understanding and identifying the problem and making sure that we can fix it. School foods, another very important aspect of creating this environment of health for our children. The Pew Charitable Trust is leading our work there, and then the Yale Rudd Center for Food Policy and Obesity is working with us on understanding how we can increase access to healthy drinks and reduce the access to sugar sweetened beverages in America. I heard a statistic recently that shocked me. And I double-checked and triple-checked to make sure it was true. The average child in America today drinks their age in sugar-sweetened beverages in a week. That means a 13-year-old child, on average, will drink 13 sugar-sweetened beverages in a week. No wonder we have a problem with preventing childhood obesity, especially if they're not getting the levels of physical activity they need to be able to burn and expend those calories. Our approach through Voices for Healthy Kids is outlined here on this slide. And as I mentioned before, it's about changing policies at the community, at the state, and at the federal level. We are creating an environment where all of these organizations who care about advocacy through the leadership of our 6 hub organizations can come together, and we can empower and work with national and state and local coalitions. We can help prioritize policy positions so that we have a uniform voice across America on those 6 topics that I mentioned before. We can coordinate training and tools, and we can make sure that best practices are shared among the many organizations that care about these issues. And as importantly, we can inspire action through investing in strategic campaigns. Through Voices for Healthy Kids, in just the past year to 16 months or so, we've invested about $3.2 million in grants that have gone to local coalitions, local community organizations to help work on some of these issues. And we're testing everything we do to make sure that we can scientifically prove outcomes through our work with Voices for Healthy Kids. A very important focus of Voices for Healthy Kids, and something that I know is important to many of you in the room, is this issue of healthy food financing. We are so inspired that there are resources available through our federal government, through our states, to help focus on this critical topic of making healthy foods more available in our communities by inspiring supermarkets and community places for people to have access to healthy foods. I learned earlier today, actually, that for every dollar that is invested by our governments, either federal or state, public dollars, that there's a 5-to-1 ratio of private support that comes to life when we can focus in this area. This is a real opportunity for everyone in this room and all of our SEC colleagues to focus on this issue in our community. We can make a difference if we access those resources and build a coalition interested in changing the dynamics around financing of foods in our communities. The other way that we're focusing on childhood obesity in America is through the Alliance for a Healthier Generation. It will be 10 years ago next year that the Alliance for a Healthier Generation was created as a partnership between the American Heart Association and the William Clinton Foundation. The interesting story about this is we were, of course, saddened but inspired by President Clinton's heart problems that he had. We were inspired because President Clinton was willing, shortly after his heart surgery, to talk about how he got to the place that he needed to have heart surgery in the first place. And as we met with him to talk about how he might make a difference in helping to change the dynamics around health in America, he talked very emotionally about being a fat child in Arkansas and how the food choices that he made, the lack of physical activity, really led to a lifetime of not being healthy. And so it was through that inspiration that together the American Heart Association and the Clinton Foundation realized that we could make a difference by focusing on this issue of childhood obesity. So we created the Alliance for a Healthier Generation with a promise that we would bring the unique assets of our 2 organizations together and focus around changing the dynamic programmatically in schools, after school, with industry, and through healthcare. The hallmark program of the Alliance for a Healthier Generation is our Healthy Schools program that has reached 25,000 schools in America in the past 10 years. And we've focused the efforts largely on underserved communities. And in these schools, we have absolutely changed the dynamic of the environment in these schools. We've changed the way that physical activity is taught. We have changed the way food is served in these schools through landmark industry agreements, like the agreement 7 years ago with the beverage industry, the American Beverage Association, and large beverage manufacturers and bottlers in America. We were able to remove almost 90% of full-calorie beverages from every middle and high school in America. That is a remarkable progress and something that absolutely has made an amazing difference to young children today. Through the Healthy School Program and the Alliance, we recognize schools that are making a difference by meeting scientifically based criteria for improving the standard of what it means to go to school in these communities. Just last weekend, we celebrated the Healthy Schools Program annual recognition event, and just dozens and dozens and dozens of wonderful stories of teachers who've been inspired, administrators who've been inspired, and communities that have been inspired through the work of the Alliance for a Healthier Generation. One of our other programs at the American Heart Association focuses on the daycare setting. As I mentioned earlier, most children are born in ideal cardiovascular health, and it is through their environment and through choices that are made for them as they're aging that statistic changes. And we know that daycares are a very important setting. You know, many parents trust their children to licensed daycare facilities when they go off to work or to school. And so with NMORS, the American Heart Association founded our Healthy Way to Grow program, which is a technical assistance program for daycares across America. We've been piloting this program thanks to the generous support of the William McGowan Charitable Fund. They are helping us understand and create these standards and what really can make a difference to licensed daycare facilities and to those teachers who are shepherding the growth of our children. We also have teaching gardens. It is wonderful to see young children who've never really known or understand where food comes from. And when those schools create teaching gardens, you can see young children just light up as they're planting seeds and seeing those seeds grow into fruits and vegetables that they can grow and prepare. We were starting our strategy by actually working with schools to plant gardens across America, and we realized that we needed to do what the AHA does best, and that is to help provide assistance to anybody that wants to plant a garden. So we've created an online community of schools and parents who can look to the American Heart Association for access to information about how to create a teaching garden. A wonderful way, again, for kids to touch and feel firsthand what it means to have access to fresh fruits and vegetables. Another proud relationship we have at the American Heart Association is with the NFL Play 60. Back when the National Football League decided to focus on this issue of childhood obesity, we immediately became one of their premier partners around the issue of physical activity in our schools. In communities throughout America where there are NFL teams, the American Heart Association partners with schools in those communities to implement the NFL Play 60, which is focused on creating an active generation. Players, family members come and they adopt schools, if you will, and those schools use the tools of the American Heart Association, including our mobile technology application that you see on this slide, to help inspire kids to care about physical activity. This is a wonderful, wonderful tool and a resource where we can help people pledge to get this 60 minutes of physical activity, and we can make sure that we're providing tools and resources with the AHA and the NFL brand to schools across America. And of course, I have to mention Jump Rope for Heart and Hoops for Heart. Maybe some of you in this room have been in a school at some point in your life where you've participated in Jump Rope for Heart or Hoops for Heart. This program is 35 years old, and it has, for these 35 years, provided a venue where schools across America can learn the value of physical activity and community service at the same time, as children are learning the skill of jumping rope while raising funds to support the American Heart Association's work. We just celebrated our 35th anniversary of Jump Rope for Heart, and this past year we had about 35,000 schools, largely elementary schools, across this country participate in this program. I want to comment for a minute or two on the importance of digital technologies as it relates to this opportunity to increase physical activity and help kids and adults become healthier as they work through their health opportunities and health challenges. I mentioned before that 80% of Americans have their mobile phone within 5 inches of them 24 hours a day. And there's a whole industry that has been created around tools for prevention, digital tools for prevention. We're very excited and very inspired by these digital tools at the American Heart Association because we believe it allows us to take important messages around prevention to where people are at. And when you think about where the world is going as it relates to digital and technology, it's hard to imagine, a year from now, 3 years from now, 5 years from now, where the world will be. It's hard to remember that 5 years ago, there wasn't even an iPad. And 7 years ago, all of us had phones, but they weren't very smart. And now you think about how that has transitioned over time. Where will the world go? And how can we inspire innovation and creativity as it relates to using digital tools for prevention? I see lots of young faces in this audience. I would encourage you to think about that. How can we utilize what people already have and create new ways to use these tools to prevent the risk of obesity in America? So my message to you, the SEC, is really threefold. You can make a difference with these problems. You can help us turn the tide of obesity in America. You can help create a culture of health in your communities, in your states, and in this country. You have enormous leadership positioning in your states. What you do and what you say matters. So imagine if you devoted additionally, some of your research focus on this area of knowing and understanding prevention. I look over at Dr. Pate, who's devoted his life, his research life to this topic. We know when we look at research broadly in this country, most of it is focused on either the mechanistic underpinnings of disease, or it's focused on people who already have disease or who have risk. How can we get ahead of the curve? We will continue to see people struggling from these diseases that they don't have to struggle from unless we can get ahead of this and understand how do we inspire people to care about their health? What will it truly take to prevent these diseases like obesity? We know that nutrition and education are very, very important. I mentioned early the healthy financing initiatives. How can each of your universities take leadership roles in your communities by making this a pillar of your work? I researched what all of the SEC schools are doing. You're doing some remarkable things. I would just say there's so much more that all of us need to do, including those of us at the American Heart Association and with wonderful partners like you. The other thing I would ask is, how can you help create an environment where the students can own this issue? Student ownership can make a world of difference here. I loved hearing the statistic recently from someone at the Gates Foundation, actually, that talked about the fact that young people today are most interested in, after they graduate from college, in going to work for organizations that are doing things that matter to social good in this country and in this world. They're not so interested in going to become the next broker at Goldman Sachs. Let's capitalize on that interest and help reverse the trend of obesity in our communities, and let's use the brilliance of our students to create new and innovative solutions to get people to care about this issue and to help mobilize these advocacy initiatives community by community by community. That's what it will take to make a difference. And finally, as I close with this slide that really illustrates some of the remarkably horrible statistics about obesity in America. This is something I think about every single day, because until we can turn the tide of obesity in America, people will continue to needlessly suffer and die from heart attacks and stroke. People will spend their life losing the value of what they care most about in this world, and that's time with their family, their friends, and their loved ones. And it's because of statistics like this and the need to reframe the conversation into something that people can grab onto that at the American Heart Association we have just recently rebranded the entire way we think about our work. Why do we do what we do at the American Heart Association? For one simple reason: life. Life is why. And I would invite you to join with us at the AHA to help people realize the most precious moments in their life. And those precious moments will only come if people have health that they can enjoy. So thank you very much for the opportunity to speak with you today. It's been an honor and a delight, and I would be pleased to answer any questions if anyone has questions. Thank you. Questions or comments? Yes. I think there's a microphone coming.
Hi, I'm Sherry Barkin from Vanderbilt. Thank you for your inspiration, for your vision, for your focus, and for pulling it all together. And I think that you've emphasized that things start early. In fact, in Tennessee, by the time children enter school, a third of them already are overweight or obese. And so many of the initiatives that you've presented to us focus on early childhood, meaning really in the elementary school, and then you mentioned your partnership with Nemours for preschool. How do you see engaging the pregnant woman, the younger child, infancy, when we're setting all types of satiety and setting sort of the architecture of our hypothalamus and all of those other things that are so important that you need to get to even earlier?
Yes. Thank you for that question. I could, of course, talk on and on about all the things we do at the American Heart Association, and one of them is our focus on women. And we have had a campaign for 10 years as well called Go Red for Women, which is focused on women and heart disease. More recently, we have expanded our messaging and our intent of the Go Red for Women campaign to help women understand the important role they play in helping to create this culture of health, including as they're raising their families. And so it all has to come together so that we can create this society where from the moment a child is born, we have an environment where those children have a chance to be healthy from the beginning. Thank you. Other questions? Yes, sir.
Well, thank you for mentioning physical activity often. Can you tell me why physical activity is not included in the American Heart Risk Calculator?
We have many risk calculators, so you may be speaking about the risk calculator related to our cholesterol guidelines, because in our Life Simple 7 tool, which is the foundation of all of our programs and activities at the AHA, physical activity is absolutely included there. We did recently release a risk calculator related to 10-year risk for heart disease, and that may be the question that you're asking. Is that? If you look at mylifecheck.org, you will see physical activity prominently displayed, and that is really the showcase tool of the American Heart Association. Thank you. Other questions? Okay. Thank you very much. I hope you have a wonderful conference and meeting.